Today, the state of Minnesota put a dollar figure on how much it could lose in federal health insurance money. We're talking about Medicaid here, the largest source of health insurance in the state.
The possible reduction is part of a plan by Congress to cut federal spending. Health leaders say these cuts will impact low-income communities and vulnerable populations the most.
Minnesota stands to lose a lot of money. Brittany Ehrman's in the newsroom now with the numbers. Brittany?
Kevin and Lindsay, the Department of Human Services puts the loss at $1.6 billion annually. I spoke to a woman who says she cannot afford to lose any more benefits.
I want to be able to take care of myself. I want to live with some dignity.
Mary Jo Hickok views getting older as saying goodbye to your independence.
You and I are used to thinking that somebody will be there to help me figure things out and to make it okay.
But lately, she's not so sure.
We're worried about Medicaid, worried about Medicare. If I can't afford my drugs, it's going to be a problem. If I can't afford to go to the doctors, that's a real problem.
And how does that feel that you may not have that health?
It's so scary. It's so scary for me.
House Republicans are proposing Medicaid funding cuts in what they call the, quote, big beautiful bill. The Minnesota Department of Human Services is already brainstorming how they can balance the state budget with gaps in funding.
And that will pose some very difficult questions with respect to provider reimbursement, as you mentioned, who's eligible for the program potentially, in addition to the benefits that we're able to cover.
State leaders say the changes could lead to vulnerable hospitals closing and staff being laid off while emergency rooms are overwhelmed.
The ultimate result of these cuts would be that people would skip preventive care, health outcomes would worsen, and costs would rise for everyone, not just people who lose their Medicaid coverage.
Who cares about these people? We could just throw them away is how it feels like to me. Like the government's plans are saying, you don't matter.
And if these proposed cuts are passed, some of the changes could go into effect as early as the end of 2026. Kevin?